Hello everyone and welcome back. Today we are joined by Shub Basu, who is a consultant MSK radiologist. Now Shub and I first met at our tennis club, so this is a slightly more unorthodox, non-work related meet. But since then we've got on to work on a couple of different projects together, so I'm really looking forward to talking more about how he came to where he is now. So Shub, thank you very much for joining us today.
Andy, thanks very much for the invite. Good to be here. Nice to see you again.
Yeah, absolutely. So just starting off then, so where are you actually from originally?
Well, I'm born and bred in Wigan, actually, believe it or not. And that's where I grew up and did all my schooling. Family originally from India. But yeah, I'm pretty much born and bred in Wigan, and all my schooling was done in Lancashire.
Well, I actually did see that. I checked you out beforehand, which again, I didn't know before, but you went to Scaresbury Hall.
That's right. Yeah, absolutely awesome time. I talk about this to my family and how I miss those good times. Really good, really good place to be. Lots of open fields, lots of scope for doing sports at that time, and that's how I kind of really delved into all my various interests in kind of playing and watching different types of sports.
Yeah, well, I went to Birkdale High, so I'm from Southport originally. So we used to go up to play against Scaresbury Hall. So I know that very well. Drive past it on the way to the motorway as well. So
Yeah.
yeah, oh, very good. So after Scaresbury, then what did you go on to do?
So yeah, like I said, I kind of grew up in the Wigan area. Went to school in Southport and Scaresbury, and then I did my A levels effectively in Winstanley College. So I kind of came back to Wigan and spent a couple of years there during my sixth form years. And then beyond that, it was a question on the table really for me about what do I want to do. And I had a medical school application on one side of the table, and believe it or not, an application to become a pilot on the other, and join up with British Airways and their apprenticeship at the time. And because I love flying and I love traveling, and that was one of my kind of passions quite early on. But then, I eventually went down the medical route and chose that and ended up in London for university. So I was pretty much down south for a good 7-8 years with my training at that time.
So what was it that tipped the balance in terms of medical rather than flying then?
Do you know what? My father's an orthopedic surgeon. He's retired now, but I've had a lot of exposure to medicine, essentially from my dad. And it's something that was always in the back of my mind. Seeing my dad come back from work, going into work with him a few times, even as a kid. Seeing how everybody used to work well together in that kind of camaraderie back then. It was really interesting, and even to me at that age, I found that really appealing. So I suppose medicine was always on the table, but I did question whether that is what I really wanted to do or not. But ultimately, coming from a smallish family, the decision about being away for long periods of time, potentially, etc., with aviation, of course, it just tipped the scales perhaps more to what kind of lifelong. This is probably the career that I could see myself in, I guess. And that's kind of how it all kind of started, really.
And so when you moved down to London, what was it like moving from Wigan, which is a very northwest town, down to the big city? What was that like?
Oh, absolute game changer. I think, first of all, nobody really understood what I used to say. My best friends were actually all pretty much down in London now, and they've always lived there. I remember them saying to me just a few weeks ago, do you remember when we first met at university, that first day in the lecture theatre? None of us could understand a word you were saying because I had a really broad northern accent, of course. London was a fantastic place. I had a really good time there, and I had a number of options with medical school. I applied to a few of the northern universities like Sheffield as well as Nottingham and had a look around. But I suppose in the back of my mind, I always knew that the medical training is going to be a long period, at least 5 or 6 years at university. And I really wanted to go somewhere that I could explore as well, as a person, so we've got the studies alongside doing things outside of medicine. And for me, London at that time was probably the place that I wanted to kind of base myself really at. And then going down there, very different to Wigan. It's very cosmopolitan, even more so now than it was back then when I was at university, but very cosmopolitan even then, with lots to do. It's like a 24/7 kind of lifestyle, really, kind of socially, amongst other things. And it's something that I really, really enjoyed, and grew to explore and grew to love. And even at the end of my 6 years of medical school training, I didn't really see everything there was to see. So I think it was the right choice for me, and I really enjoyed it, and I have no regrets on that.
And whereabouts were you living then when you were down there?
So I lived near the kind of city and kind of the east side, near the Docklands area. So near like Canary Wharf, effectively now, where Canary Wharf is, and the Millennium Dome. So I was pretty much based in the city and the East End, as my medical school was. It's known as Barts in London now, but it was in St Bartholomew's and the Royal London Hospital, which had just merged together. So that's where I was pretty much based, and used to commute in from the northeast of London on occasions, for sure.
Yeah, I can imagine that is a massive awakening when you head from the northwest down to London and being there for university. I think I would have found that maybe a bit mind-blowing at that stage, but now it's a great place to be. So then when you're studying, like at what point do you have an idea of what you want to go into? Like you mentioned sports before, did you have a vision of what you wanted to do once you were fully qualified?
Yeah, do you know what? I went into medical school thinking and my dad's an orthopod mind, so I came into medical school thinking, you know what, I don't want to be an orthopedic surgeon. I don't want to be a general practitioner. They were the kind of common things that used to be kind of banded around. But I went in thinking I'll be a cardiologist, and that was kind of my plan, really, to become a cardiologist. And I went through my early years of training, certainly going down that route. And then, the career thing just changed as I went through medical school. And, you'd go through all the various different specialities in your lectures and your talks and the modules. And everything was really interesting. I used to find all the various specialities, neurology, the gastro modules, musculoskeletal, everything was at that time really, really interesting. And I suppose it's only once those clinical attachments started into the hospitals and you were part of the various firms that I really got a bit more of an insight onto what the different specialities do hold on offer. And I do recall, and I still recall to this day, and it's something that I always pass on to my kind of junior colleagues and trainees, one piece of advice, and it came from an A&E consultant. I think I was a fourth year medical student then. And he said to us, to the group, if you're not sure what you want to be, just take a look at the consultants around now in their various specialities, because that will be you. That's going to be you in a few years' time. Can you see yourself like them? And honestly, it's the best advice ever, because I really took that on board. And you go through all the various different specialities and see all the various consultants and think, no, I can't be like that person, or no, I'm not sure about gynae there, or whatever. So that's pretty much how it kind of all went through medical school. Really, it was all a bit of a jumble mix, really. And then I came out on the other side, qualified, and as a junior doctor, you have to go through various rotations in the different specialities. And the exposure that gave me essentially led me to where I am now.
So then, at what point was radiology even on your radar at that point?
Absolutely not. Radiology was just it's a different speciality, and not something that as an undergrad, as an undergraduate student, one would even consider. We had very little, I suppose, lectures or imaging talks in our curriculum back then. And it was not something that I considered at all. Traditionally, radiology used to be very much a postgraduate speciality. So, people would go through medicine or surgery. They may well have kind of gone into training for several years and into their kind of various subspecialties, and then for whatever reason decide to cut loose and think of something new. And radiology would often be a fallback. So you'd often get lots of senior trainees in other various specialities drop down into radiology and almost restart the career again. I was very close to orthopedics once I was a junior doctor. I did a rotation in orthopedics down in Essex at the time, and absolutely loved it. One of the best firms, really good. Orthopedic surgeons are a good bunch of fun, as you know. Had a really good time. I was very, very close to kind of going down the route of orthopedics and applying. But I must say, then after my orthopedic rotation, I did a rotation at trauma surgery in probably one of the biggest trauma units in the country at the Royal London. And that was like an absolute kind of mind-blowing, literally a mind-blowing experience. You know, the kind of things you'd see there, the trauma was just incredible. And as a junior doctor, and as a young man, you know, in your kind of early 20s, the things you saw, you know, just makes you think twice, really, and you know how, you know, reminds you how precious life is. And it was actually in that rotation we used to have regular daily radiology meetings with the radiologists, and we'd kind of go over all the imaging of the admissions that used to come in overnight, all the kind of trauma, looking at MRI scans of the head and neck to CT scans of the entire body. And you know what, I thought, this is actually really cool. This looks amazing, you know, looking at the inside of the body and trying to make a diagnosis or diagnoses, which then, you know, leads on to appropriate management for the patient. You know, I thought this is actually really interesting and something very different, and something that I wasn't really exposed to as a student. And that's probably where the interest actually started to really, you know, come to the fore, I guess.
And how big a thing was that then? Was that like something that was, there's so many different options available to you. How many people were looking at radiology? Was that a popular area to go into?
Radiology has traditionally been quite a competitive specialty to get into, not least because the numbers or the vacancies for training posts were very, very small at the time, and you used to get a huge number of people interested in coming in. So shortlisting for interview and actual interviews were very, very competitive indeed. And I suppose the game changer for radiology, you know, and as we see radiology now, pretty much stemmed in and around that time, you know, the mid 2000s, early 2000s, where you know, when PACS came in, so the picture archive and communication system and digitalization of imaging effectively transformed the whole speciality. You know, one of the kind of annoyances, if you like, as a junior doctor used to be having to, you know, get all the printouts or the hard copies of x-rays and things that your patients had, and, you know, they'd often be lost on the ward, you don't know where they are, and, you know, your consultant shouting at you on the ward round for not having everything ready. You know, going from that to essentially being able to look at someone's imaging instantaneously on a computer screen, you know, just transformed how radiology operated. And we're seeing the effects of that now, where you've seen the mass explosion of all the various imaging modalities, really, from X-rays and ultrasound, as you know, to CT and MRI. So yeah, I think it was a defining moment really at that time, and you know, I was just coming into that kind of position, if you like, of the transition of the radiology as itself, and I think that's what I found really attractive.
You mentioned the different modalities there within are there any things that you particularly have to specialize in that? Like, do you ever say, right, I'm going to look at ultrasound, MR, whatever it may be? Are there subspecialisms within that?
Yeah, so if you're training in the UK, the FRCR program, which is the postgraduate course and examination that comes out of a radiologist in their training, essentially incorporates all the imaging modalities. So you would go through all the different imaging modalities in terms of the written training as well as the practical on-site experience. And that's kind of part of a general radiologist remit, if you like. There is some core knowledge that you would need to have, irrespective of whatever specialty you decide to go into eventually as a radiologist. If you go overseas, other countries do it slightly differently. And I know that in certain countries, for example, in India, and things are changing now, but certainly several years back, as a radiologist, you'd often be a specialist in an imaging modality. So you could do your radiology training and come out of your training, but then you'll be a radiologist of ultrasound, for example, and you'll cover all the specialties, whether that's MSK, general radiology, gynae radiology. You know, you do the whole gambit of ultrasound. And likewise, if you're doing MRI and you're an MRI specialist, you would be covering the GI tract, the GU, gynae, musculoskeletal, the whole works. So it's very imaging based. But in the UK, it's very much integrated. So we kind of cover a bit of everything, really. And I feel that's probably the best way to go, personally.
Yeah, so you cover the whole thing. So if you were to describe like the main role of a radiologist, How would you sum that up in a succinct type way?
I suppose the main role of a radiologist is to say yes and never say no to any imaging requests that come through, given the volume of work that we get nowadays. It's completely transformed. But look, as a radiologist, we're evolving as a specialty constantly. And again, that was another thing in the back of my mind when I went into the specialty, in that, I thought to myself, I'm going to get into radiology now, but then probably most likely by the time I come to retiring, I might be doing something completely different to what I started off as. And that was really attractive. So as a radiologist, the prime remit is image interpretation to try and get or garner a diagnosis or a differential diagnosis for your patient. And that was the kind of mainstay, if you like. And that's going to be morphed as time goes on with the different subspecialisms coming through, particularly interventional radiology, whereby now a radiologist has a strong role in treatment of certain conditions and diseases. So, as a musculoskeletal radiologist, as for myself, being able to inject and treat and manage patients, that's another kind of expansion of my role, if you like, from being a diagnostician. And interventional radiology as a whole is its own speciality in its own right. And you see radiologists that are treating complex trauma cases when it comes to embolizations or stenting patients, amongst other things. So there's a whole gambit of stuff now. So we're very much speciality of diagnosing, but also treating more and more.
Yeah, no, that's really interesting then. So in terms of getting to that point, what happened when you'd graduated, you moved into radiology? What was the next path for you there?
So after kind of graduating with FRCR, and completing your training, which I completed in Manchester and the Northwest region, so I kind of rotated around quite a few of the NHS hospitals during that kind of 5-6 year period. I then went on to do a fellowship, so I spent an extra year to study and focus on musculoskeletal and sports imaging, because that's really what I wanted to do as I went through my radiology training. And I did that back down in London, so I traveled back down there for a year, this time staying on the west side of London. So it was nice to get a nice experience in life of both the east and the west side of London. And then following on from that fellowship, you go into a consultant post. And I applied for my first consultant post, which was at Salford Royal, as a musculoskeletal radiologist. And I spent a very short time there before I decided to make the move to where I am now, which is at Wrightington Hospital, part of Wigan.
And so what made you want to move back north then?
Family, for one, I guess. And, I've always enjoyed, growing up in the Northwest, living in the Northwest. As much as I loved London and really kind of maximized my time down there as a student, I think when it came to work, it was very different. Work is really busy. It's very intensive, and I suppose everything else around. You think about the common things, expenses and cost of living, being able to do the things you want to do. I quite like the openness and the countryside kind of living, and obviously growing up where I did, and it was nice and open, and transiting from there to kind of inner city life was huge and quite tough actually at the start for me. But I always wanted to come back, I feel, to the Northwest, and right now I'm chuffed a bit because medicine, as we know, can take people around the world really, and you often end up somewhere far, far away from where you grew up. But I've got a very good job satisfaction. It's very gratifying that I'm able to work now effectively in my local hospital where I grew up. So I feel like I'm giving a lot back to the community that gave a lot to me. So yeah, thrilled.
Yeah, no, that's great. And then again, we know each other via tennis, but how did you get involved with that? Is that something that you've always played growing up?
Yeah, as a kid, used to play quite a few sports: tennis, cricket, and football were the kind of main things that we used to do, and running as well, athletics. And I just, any excuse to kind of go out onto the field or kick a ball or hit a ball. But then I kind of slowly, as I kind of got into my early teens, kind of focused more on the tennis, I guess. And, parents at the time used to take me down for regular coaching at that time at Wigan, at Robin Park. and really enjoyed the coaching and playing, playing for local clubs and playing in the leagues. And I used to pretty much play nearly every day of the week, and certainly kind of 3 or 4 nights a week and stuff. But then that dried up when I went down to university. When I went down to London, obviously as a student, it was very expensive down there, and trying to find any reasonable tennis club nearby was quite hard at the time for me. But it's something that I managed to kind of stick with my tennis club in the university, which then allowed me to become tennis captain as well, and that was really awesome. So yeah, it's a sport that I hold very dearly, and as you know, carried on playing into adult life.
Yeah, no, absolutely. So I've seen on social media you've got a very cool picture of you. Well, I'll say I've Roger Federer stood in the forefront, and then someone in the background, which is you, judging the lines. How did you get involved in umpiring?
Yeah, so tennis umpiring. Well, again, it was down in London when I went down there. The playing side of things really kind of dried up for me, and I was really missing playing the game. I don't know, some tennis kind of fans may remember a magazine that we used to get called Ace. It's called Ace magazine that I was a subscriber to back in the day. And I remember getting that and just going through the pages. And then there was a double spread advert on, in big bold letters, Wimbledon, ? Do you want to be there? And, that caught my eye. And then when we kind of look into it, it was a case around, do you want to get involved in tennis umpiring and officiating? I thought, oh, well, that looks different, and it looks really interesting. Something to be able to stay in touch with the game, very appealing. I thought, okay, why not give this a go? And so effectively had to then go on a course and get trained, and that was down at Queen's Club at the time. So I was down in London. It all kind of made sense. It was very easy for me to get down there. I applied, got admitted onto the course, and had to go through all these various assessments, which was kind of nerve-wracking. Believe it or not, you need to know all the kind of theory, and then you have an on-court assessment as well to see whether you're kind of loud enough to be an umpire. And going through all of that, eventually I came out on the other side, and then off you go to officiate essentially at tournaments around the country at different levels. And then you do that, and eventually things like Wimbledon and Grand Slams and the big kind of ATP and WTA tournaments are accessible for you. So that's how I got into tennis umpiring, and it all kind of stemmed as a medical student and having relative lack of access to tennis as a player. So I kind of jumped ship to the other side.
That's amazing. So what tournaments have you worked on then?
So in the UK, usually, most of the kind of big tournaments tend to hold in the kind of summer season coming up, as we know, the grass court season. So I've worked in places like Nottingham. I've worked at Queen's, the Queen's Club at London a few years, and the WTA tournaments at Edgbaston in Birmingham, and also at Eastbourne, and then finally Wimbledon. Done several Wimbledons now, like 14 or 15 Wimbledons to date, and it's just an amazing experience. Being able to not just officiate with your heroes as a tennis player, as a tennis fan, having all these top players right in front of you on court, but also other things like meeting other people from outside of medicine. For me is really important. I like my job and I love all the people I work with, but as a person, I didn't want to kind of go down a single track. You want to be able to diversify, your experiences, and tennis umpiring certainly helped me to do that. Meeting people from all walks of life, of all different ages, and from all around the country. So, that was really fulfilling. And I've only done one overseas tournament, which was down in Doha a few years ago. I think it was a WTA event back then. But yeah, it just gives you options to travel as well if that's what you want to do. So yeah, it kind of worked out really well for me, particularly as a medical student at the time. And then I've managed to carry that on as a doctor, which I didn't think it would be possible, but I've somehow managed to do it.
Just from a personal side then, so how long are you, when you're out on the court, like what's it like? You're there in the full gear, centre court or wherever it may be. Like, what's it like having to keep your focus when you've got, say, I don't know, what's a particular game that you can remember that it's like really sticks in your mind?
Oh, I mean, Wimbledon. I mean, so you're referring to Wimbledon, I guess. And Wimbledon's, look, it's a special place to be, and people often ask about the special moments or the special moment. And I've always got. I haven't got one. I must say, I've got quite a few, because every new event creates that kind of new feeling for me. And from the very first Wimbledon to the very first time I went on a court and stood on the court, which is one of the outside courts, the old Court 6, which is no longer there now. Everything's just mind-blowing, and as a fan you just freeze. And centre court, of course, it's the hallowed turf. The centre court, very special place to be. And I remember the first time I went out onto centre court, walking out, and I was leading the team then as the line official at the front of the queue, if you like. So you're the first one onto the ground. Couldn't feel my legs; they were like jelly, and I had to walk all the way around to the bottom end of the court. And it was like a massive long walk. And I thought, how am I going to do this? And your heart's beating away, you've got palpitations, your legs feel like jelly. And, it's just one of those things, you just, once you get into it, you suddenly settle down. But yeah, you need concentration for sure. The way we work at Wimbledon tends to be on a shift pattern. So as a group of team members, you go on court, usually for about 60 minutes or so on average, and then you're off court for 60 minutes. So you have a bit of a rest break, and you just rotate like that throughout the day on your allocated court. So you may be allocated a different court each day, and 60 minutes might not sound like a long time, but when you're there and on a match, especially when it's intense, it can feel like, wow, you're really in the lion's den, like in the Colosseum. And I think the most special match, I think, for me, must have been the last time we were at Wimbledon. So not last year, the year before, men's semi-finals between Roger Federer and Rafael Nadal. I mean, it was a long time before they both played against each other at Wimbledon, but that was special. And I was the service line judge for that. So I was on the off the court on the side, if you like, but calling the service line. So literally every point was active and in play for me. And, it's just one of those things where you're kind of buzzing with the adrenaline going around. You've got two top players, and, a very special atmosphere. I think everybody inside in the stadium, in centre court, you could feel that was something special. Will we see it again? We don't know, but that was amazing.
Yeah, I mean, to get to see those two playing against each other at centre court, I can only imagine that must be absolutely unbelievable. Yeah, no, that's good. Yeah, coming back to ultrasound then. So in terms of your involvement with sport from a professional standpoint then, in terms of imaging, how did that first start? So
in terms of musculoskeletal work, which is what I kind of primarily specialize in, I work quite closely with a network of clinicians, so a group of orthopedic surgeons and sports medicine doctors and clinicians. We've worked quite closely with a few that you've kind of worked together with, really, in terms of teaching and training ultrasound, etc. And you just build that network. And I think one of the key things for me as a radiologist, and one I take pride in, is having that kind of network, really, and having the open channels of communication. So when we're doing our work, it's not a case of a scan's landed on my tray and I'm reporting or I'm performing the ultrasound. It's about having the kind of real life conversations with the players, with the clinicians and the referrers and the physios, to work out what the problem might be and then identify that and work around that. So that's how I've really kind of gotten into the kind of sports world, I guess, and working within that kind of team framework, really.
And how do you balance the different roles that you will work in? So obviously you've got Wimbledon, which is kind of like, well, the tennis, I should say, on a separate standpoint, but then you've got NHS work, private work, orth team, all of these different areas. Is that an easy thing for you to manage?
It's a very good question, and I could probably say no, it's not very easy to manage at all. And maybe I'm not doing it right. Maybe I do too much. And interesting, I was just speaking to a sports clinician earlier on before coming here, and he was the same. I think, look, I think we're all very passionate and driven for what we do, and we like what we do. We give everything and all to it. And it's not just about the work, I suppose. There are other things, that you mentioned the tennis from my point of view, but I'm also quite big on teaching and education, and I have roles at the universities in Manchester, but also as a supervisor and to radiology trainees. And I like all these different roles because for me it kind of makes me, I think, a better person. It makes me grow as a person. I feel that taking points from all these different areas helps me to become a bit more wholesome, makes me become a better person, makes me appreciate the different specialities and disciplines more, I think. And so, yes, life can be busy and life is about juggling these things, but, I wouldn't change any of it, even if I'm busy. And, as we've seen over the last 12 to 18 months, life is very precious. And, when you have restrictions in place, you can't really do much, you miss those things. I'm quite fortunate to be able to still do all those things. But yeah, it's not easy, I must say. Good bit of diary work, good supportive family, and very important to make sure you take the breaks, the right times, and get time to recharge, really.
Have you ever had any roles over the years that you thought, yeah, that was really challenging, even if it came out to be positive in the end, at the time you're thinking, this was not something that I thought it was going to be?
That's a good question. Any challenging roles? Well, I guess even just as a basic consultant radiologist, making that transition from a kind of junior doctor, if you like, or a doctor in training to become the boss, if you like, on a firm in your hospital, that comes with big responsibilities. And I've ended up in places where I know my senior colleagues because they trained me. They're my trainers, and I hold a lot of them in high regard and high esteem. But then you're the decision maker eventually, and people start coming to you asking for your advice and asking, what would you do next? And I think that transition it's not always easy for everyone. And I suppose, the challenges that posed at that time in my career as a very young consultant was something that I needed to get used to. But then, when you have a supportive team around you, and that's crucial, bouncing ideas off people, being able to talk to people about issues, that just means you can manage all those things relatively well. And that's kind of got me to, I suppose, where I am today. So challenges are always there, I think, but you just have to be headstrong, tackle them, have a good mindset, and have a good team of people to work with, and you'll kind of solve those problems slowly but surely.
Yeah, no, fully agree on that one. And in terms, you mentioned the last year or so, how have you found the change in terms of consuming data? There's been no conferences. How do you keep up to date with things, either from a conference perspective, research? How have you found that?
Yeah, I mean, well, life's changed, isn't it? It's completely transformed, and what we're doing now with the podcast and things like conferences have all essentially switched to kind of online. There are a few meetings and conferences that I chair and arrange speakers for, as well as speak at, and the kind of advantages of those kind of things back in the day, where you get to travel and you get to network and meet people face to face. And socialize afterwards. And we've kind of missed all of that for the past year. But technology as it is kind of transformed things and kind of evolved really what we were doing before. And maybe it's just a matter of time. But that's just been fast forwarded to now with tech and online conferencing and meeting, which has meant that everything's a lot more accessible for more people, which is great. People that couldn't essentially meet up or travel to a certain conference or a meeting can now sit on the other side of the world and listen to a lecture or a talk, or attend a meeting virtually. So I think that's a massive positive, and opening up education to so many people now is great. As a practitioner and as a teacher and an educator, it's transformed the life. You've become a lot more busier to a degree. Before, when you couldn't attend a meeting physically, you just said sorry and you send your apologies in. But now with lockdown and or having lockdown, you didn't really have an excuse of, I'm sorry, I'm not around, because you're doing something, because you weren't doing anything except maybe watching Netflix or in the garden or something like that. So it became a lot more busier, I must say. MDTs and our workplace sites have again been transformed. Most of it's done virtually now. And being able to make that transition and utilize the imaging and sharing that data online was a learning curve as well. But now it's almost like second nature, and it's part and parcel of our working life. And I really don't think that's going to dissipate or go away. Even if things go back to some kind of normality, I think it's here to stay and great positive.
Yeah, no, I agree on that one there as well. Obviously, you're still going to need some physical interaction and education for different things, but I think there's massive positives in terms of that. So I mean, we're relatively new to working with ultrasound, but we've just seen a massive explosion in terms of the demand within MSK particularly. What's your thoughts about diagnostic ultrasound in wider practice being adopted more widely?
Well, we talked earlier about how the imaging and radiology has become a victim of its own success. It's very tech heavy. And as we know, with our kind of iPhones and, phones and tablets, there's constant updates all the time. And radiology is no different. It's a very expensive specialty. There's a lot of investment always in all the different paraphernalia and different equipments. And they constantly get updated. And alongside that, the fact that you can see a patient, scan a patient, get a report out, and all that kind of whole turnaround time is so much less. The patient pathways are completely transformed. And being able to address so many more questions now through imaging compared to what we could do before has meant a massive explosion in those referrals. So, there's not enough hands on deck to be able to meet that demand, whether it's a radiologist or sometimes even radiographers, with the purpose of MR, but also sonographers and ultrasound. So, I think it's just a matter of time. We're probably there already, and I can only see it getting even bigger, the kind of expansion, if you like, of some of these imaging modalities, ultrasound being the prime example, where a lot more people outside of that traditional radiology sphere have now got access and are now willing to learn and train to be able to incorporate that into their practice to try and address all the kind of needs of the demands that are out there.
And one of the concerns that we have when we're interacting with a customer about something is that, well, no, we've got a very good relationship with our radiologist. We don't want to tread on their toes. Would that be something, do you see that as a positive or a negative, that they would have imaging, but then still work with you on things?
I mean, imaging, the training for learning how to do ultrasound isn't quick, nor is it quick for any other specialities. And if you speak to some of our sonographers who do ultrasound day in and day out, they will vouch for the fact that their training was over several years, involved going to university and et cetera, and we were no different. I think I don't really have any personal objections to people outside of the discipline necessarily wanting to practice ultrasound, as long as they've got the appropriate training and the appropriate accreditation and the appropriate experience, because you are essentially then out there treating real live patients. And I think that's probably the kind of thing I'd always fall back on, that the more the appropriately trained practitioner would be able to go out there and practice ultrasound. I think one of the other kind of arguments, or I've heard the counter arguments that are made, are essentially that clinical practitioners who see and examine patients can use ultrasound as an extension, if you like, of their clinical acumen to help support the diagnoses. And I see that argument as well. Sometimes those people will have great experience in certain kind of pathologies and specialities that they work in. But you've also got to be aware of something called selection bias, and the fact that you've seen and examined a patient. In the back of your mind, you think this is what's going on, and there's always the risk that when you scan, you may want to feel like, those imaging findings on the scan probably correlate with what I'm finding. And I know, working with some of the orthopedic surgeons that I do work with that can scan and do office ultrasounds, they often then go on to request a separate scan. So an independent review from somebody like me or a radiology colleague to do the scan themselves and see what they come to in terms of their conclusions. So that way you've almost got, two for the price of one, really, with a scan by a practitioner and also another independent review of a scan, if you like, from a third party.
Yeah, no, yeah, it seems to make sense to me. As long as you know what you're sticking to and you're not trying to overstep in terms of knowledge base. Yeah, no, that's really interesting. So, final question: who would you say, it doesn't have to be one person, but who would you say has had like the most influential influence then on your career or life?
It's a very good question. That's a toughie. Well, look, I put my parents up there. I'm very fortunate, I'm an only child, and my mum and dad gave everything for me when I was growing up here to support me as a young kid, allow me to do the things and express myself the way I wanted, with all the various extracurricular activities that I did. And then they were very supportive of me kind of going through medicine and that regard. And, I saw my dad as a role model in that sense, seeing him work the hours that he did in those times in the hospitals here. And, very different before the European Working Time Directive came in. It was, hardly used to see my dad to a degree and sometimes. And, I saw the work and the effort that he put in. So 100%, I'd say my parents there. And then I suppose, without trying to sound too cheesy or corny, but something like Sir Alex Ferguson, as a manager of Manchester United, ex-manager of Manchester United, what he's done over a long period of time, it's absolutely incredible. And that's what life is about, because, you'll go through, no matter what background you're in and whatever speciality, whatever line of work you're in, there'll be a constant kind of evolution, if you like, of practice. And I think it's very important to be able to keep abreast of that, I think, to be relevant and to be good and to improve. And I think that's something that I saw, as a football fan, and, seeing somebody like Fergie having to deal with, players, having to deal with circumstances and just how, things like, football, for example, has changed, and keeping abreast of that and still garnering that respect, from people, from all walks of life. That, I've always taken that on board, and I think, that's really impressive. And if I can do anything like that, then not necessarily manage a football club, of course, but have that longevity, but being able to be flexible and adapt and evolve and always look to improve myself to be better and do the best that I can, then I'll be happy at the end of my career.
No, absolutely. I saw an interview of Rio Ferdinand on Ruud van Nistelrooy, and it was, no one's got a bad word to say about Fergie, really, have they, in terms of who's been managed by him? But yeah, when you've got legends like that talking about it, then it's pretty impressive. So even though I'm not a Man United fan, you can definitely appreciate that. But Shub, that's been great. I really appreciate your time on that. It's great to get your insight here, some of those tales. So thank you very much for sharing. And I'm definitely looking forward to working with you on some projects going forwards. And yeah, I'll hope to see you in person soon.
Yeah, thanks so much, Andy, for this. This was really nice chat. And yeah, look forward to working with you collaboratively soon, definitely.
Great. Thanks. All the best. Thanks, Shub. Cheers.
Yeah, cheers. Bye now. See you.